Good afternoon, everyone. Hope everyone is doing good. It is 3 o'clock, so we will get our meeting underway. Thank you all for being with us, and thank you to House Media Services once again for setting up this meeting via Zoom, and thank you to Martha Wigden for getting with our friends at NCSL to get everything put together for our presentations this afternoon. I will let you know that the chat box will be open. The presenters are going to make their presentations on the front end, and then as we get into toward the end of the meeting, they will set aside some time to answer questions. So I'm just going to ask you, if you will, please put those questions in the chat box and just use that for that purpose only. And we will get as many questions out of the way that you might have. At this point, I'm going to call on Chairman Blake Tillery to make some opening comments as well, and to call on our invocation. Chairman Tillery.
Thanks, Chairman England. Again, thank you all for joining us. Appreciate NCSL for being here. Martha, thank you for doing that. Melody, appreciate the work you've been doing as well. And at this point in time, I call on Representative Dudnick, if he doesn't mind, lead us in an invocation to get started.
Thank you, Chairman Tillery. If you will, pray with me. Lord God, we thank you for this day. We thank you for the breath of fresh air that you have given to us. Lord, we just ask for your blessing upon each of those who are represented here today. Lord, we thank you for allowing us to serve the people of Georgia. Lord, give us guidance. Give us your wisdom. Lord, grant your healing to those who are sick, suffering, and grieving. Lord, we thank you for entrusting us with this responsibility. We ask all these things in Christ's name. Amen.
Amen. Anything else, Chairman Tillery, before we get started?
No, sir. Handing it back over to you, Mr. England.
All righty. Thank you, Matt. Thank you for the invocation today. We appreciate that. I'm going to just go ahead and open us up to our presentations. And Ms. Molly Ramsdale is the director of the NCSL DC office, and has done an extraordinary job on the work that I've seen that she's done. I know Martha's worked with her a good bit. Melody has too, through the years. And so I'm going to hand it over to Molly, if she will introduce the folks that she's got going to speak to us this afternoon, and make any opening comments she may have. And then we'll let her kind of wrap all of that together in a nice package toward the end. And then we'll, as I said before, we will try to take as many questions as we can through the chat feature here on Zoom. So Molly, thank you for being with us, and the floor is yours.
Thank you, Chairman England and Chairman Tillery, and thank you for the opportunity for NCSL to participate in today's hearing. I'd also like to say thank you to Martha Wigden, NCSL staff chair, and give a shout out to Melody as well, Vice Chair of the National Association of State Fiscal Offices, and also to Betsy Theroux, Chair of the Legislative Information and Communications Staff Association. What I'm going to try and do here, I'm going to share my screen here. We've got some slides. All right, hopefully you can all see that. So what we're going to do in the next 25 to 30 minutes is we're going to start with a 1-minute overview of all the federal COVID-19 packages, and then we'll take a closer look at the funding made available in the areas listed on this slide: the Coronavirus Relief Fund, education, agriculture, unemployment, and health. That I'd like, and then again, we'll take an opportunity to talk about these. I say we because, as the chairman said, the silver lining of a virtual meeting is that a number of NCSL's policy experts were able to join me today, and I'll introduce them as they come up to speak. So let's jump right in, because we have a lot to cover today. Big picture, Congress has enacted 3.5 packages to respond to the global pandemic. And while we are focusing on the CARES Act, the one in blue on the screen, We will touch on a few of the others because in round 2, there were the FMAP increases and the UI funds were made available, and additional funding for loans for businesses was provided in what we refer to as round 3.5. We call that 3.5 because the primary purpose of that bill was to provide additional funding for the Paycheck Protection Program, which that was established in round 3. In total, these 3.5 rounds of funding provide states with a little over $500 billion, most of it through the CARES Act. This graphic shows you the major areas of funding to states and in a few cases local governments over the 4 bills or 3.5 proposals. This funding is being distributed through some 60 programs from over a dozen different federal agencies, so implementation is complicated. I also want to note that this graphic does not reflect funds states would receive through the FMAP increase provided in Families First. Georgia's portion of this funding is about $8.2 billion in total, with close to half of that, $4.1 billion, coming to Georgia through the Coronavirus Relief Fund. One of the questions we are asked most often is what flexibility do states have in the use of these funds? And unfortunately, I'm going to have to say not much. A few areas where you may want to look to find some flexibility is the fact the CARES Act does waive some matching funds or gives the secretary of certain agencies the ability to waive matching funds. Also, the transit funding has a little bit of flexibility. Not only is this 100% federally funded, it can be used to pay for operating expenses dating back to January 2020. There's also a little bit of flexibility in the Governor's Education Relief Fund, which Austin will talk about a little bit later when we talk about education. And then there's the FMAP increase in Families First, not the CARES Act. Again, there may be some flexibility where states can move around some funds there. One thing you may not notice on this list is that the CRF is not here so far as providing states flexibility. What I'd like to do now is turn the floor over to Erlinda Doherty, who works with our Budgets and Revenue Committee, to talk a little bit more about the CRF. Erlinda?
Yes, thank you, Molly. Next slide, please. Thank you very much. As Molly mentioned, NCSL worked hard to get as much flexibility as we possibly could with respect to the Coronavirus Relief Fund. And here but unfortunately, as time has gone on, we've realized that the flexibility wasn't actually to the degree that we needed it to be for states to really be able to use money as effectively as possible, and mostly for the revenue shortfalls that most states we knew were going to be experiencing. But here's just a real quick overview again of the CRF. It provides $150 billion in funds for states, territories, localities, and tribes for governments to use for expenditures incurred due to the public health emergency COVID-19. Distribution was based on population, with no state receiving less than $1.25 billion. 45% of the state's funds were also set aside for local governments with populations that exceeded 500,000. And so, as I'm sure you know, your state was eligible for 4.1 billion, of which 2. And had to be set aside for the state, with no more than 1.8 going for the localities. Next slide, please. Again, as I mentioned, Treasury was pretty explicit about the guidance for the money being used for necessary expenditures incurred due to COVID-19 that had occurred during the period that began March 1st and ended the end of this year. And they were very explicit in stating that the money was not to be used for lost revenue or expected revenue shortfalls due to the virus. Next slide. There was guidance that was released on April 22nd, which was in advance of when they had expected to start dispersing the funds, which was April 24th, and then updated their frequently asked questions list on Form A. While the guidance was pretty broad for a lot of other areas and pretty all-encompassing, and same with their frequently asked questions, there was still no explicit use of the funds or authorization, I should say, for the funds to be explicitly used for revenue shortfalls. However, we did in some follow-up conversations that we with our fiscal leaders, NALFO, the National Association of Legislative Fiscal Officers, we did have a call with Treasury officials about, I guess, a week ago, where we had some really interesting feedback regarding the ability of the funds to be used for almost like cash flow loans, as well as we did see that the Treasury was open to the funds being used for emergency legislative sessions. So if your session had to be called back as a result of postponement or premature postponement due to COVID, then also that there was an ability for the funds to be used as sort of loans or forgivable loans to small businesses. So those were some areas that we did see states being able to use the CRF funds to fill some gaps in these other areas. Next slide. Oh, and I guess that's it. But basically, to recap, we are still continuing to track any further developments with respect to the CRF to be used for states in a way that would help to make up for those shortfalls. And so that's basically that. And on to our education.
Great. Next, I'd like to introduce Austin Reed, who is our director of our Education Committee. Austin.
Thanks, Molly. For my remarks, I'm going to cover the implementation of the Education Stabilization Fund, CARES, in the state of Georgia. At this point, all Education Stabilization Funds have been made available through the Department of Education, and most expected guidance on this use of funds has been released. So there are three funding streams in the Education Stabilization Fund. First, there's the Governor's Emergency Education Relief Fund. Through this fund, Georgia is expected to receive about $106 million. The Department of Education has described these funds as being extraordinarily flexible, and they can be distributed as emergency grants by the governor to any education-related entity in the state. As of last week, I understand that Governor Kemp has not yet received these funds, but that applications are due by June 1st. Next, there is the Higher Education Emergency Relief Fund. These funds are distributed directly to colleges and universities based largely on their share of low-income students. I estimate that Georgia institutions should receive a little over $400 million. From these funds, institutions must spend at least 50% on emergency aid to students, which can cover anything under a student's cost of living. The IRS has recently determined that this aid is not to be counted as taxable income. The institutions that receive these funds are responsible for determining the process by which this direct cash aid is distributed to students. However, the Department of Education has ruled that only students eligible for federal financial aid can apply, which could exclude 7.5 million students, which would include undocumented international students who, due to their citizenship status, cannot apply for federal aid. But it may also exclude certain community college students and veterans who often voluntarily choose not to fill out the federal free application for federal student aid, which is the way that Title IV status is verified. The other 50% of funds can be spent by institutions to refund themselves for reimbursements made to students or serve as compensation for decreased revenue. Georgia HBCUs and minority-serving institutions can also expect to receive $57.5 million, which can be used for similar purposes as I've just described. Finally, there's the Elementary and Secondary School Emergency Relief Fund. The Georgia Department of Education has applied for and received their allotment of $457 million. Of this, districts and charter schools should expect to receive $411 million, which is distributed via the federal Title I formula. The Georgia Department of Education has also exercised an allowable 10% set-aside, which would result in $46 million. My understanding is the department has said they intend to use these funds as a rainy day fund for districts. Next slide, please. Districts can use the funds in the K-12 stream for a wide variety of purposes, which are outlined in this infographic provided by the Georgia Department of Education, which is one of the better infographics on CARES funds that I've seen. Given that these funds are not subject to a supplanting provision, they could in theory be used to plug budget gaps that districts are facing. But the initial sense that we're getting from the field is that these funds will likely be used to reimburse districts for increased costs they've incurred during the pandemic, especially the increased provision of school meals. These funds are retroactive to March 13th, 2020, which was the day President Trump declared a national emergency. Next slide, please. And finally, I want to note 2 or 3 ongoing issues regarding CARES funds that may impact Georgia. First, there's a maintenance of effort provision that applies to both the K-12 and governor's funds. This requires that state spending levels on K-12 and higher education in fiscal year 20 and 21 be the same or greater than the average spending levels in the preceding 3 fiscal years. The CARES Act does authorize the Secretary of Education to waive this provision if a state experiences a precipitous decline in financial resources, but the Department of Education has yet to release this waiver application process. We expect that it will be soon, and I can assure you that NCSL is closely tracking this issue. Next, there is the equitable services provision, which has become complicated and controversial in the last few weeks. The CARES Act requires that districts provide equitable services to eligible students attending private schools in their district boundary in the same manner as they do under Title I funding. So under Title I funding, equitable services are typically limited to low-income students and special populations. The district will then calculate the private school share of funding based on this student population, and then will provide compensatory education services accordingly to those students in private schools. However, on April 30th, the U.S. Department of Education released non-regulatory guidance that interprets the equitable service provision in CARES to include all students attending private schools, not just special populations. The department reasons that since all students in the district schools are eligible for CARES funds, then all students in private schools should be eligible in order for those services to truly be equitable. In some, if not many districts, this would result in significantly more money being made available to private schools. For example, the DeKalb County Schools estimated to the Atlanta Journal-Constitution that nearly $2 million of its $34 million CARES allotment would go to private schools. This has sparked a wide variety of responses from states. The Georgia Department of Education has said that it will follow the guidance, while other states such as Indiana have rejected the guidance publicly and said that they will follow the CARES statute. Most states are somewhere in between and deciding what they would like to do, and districts themselves may also choose their own interpretation. So there's a distinct possibility that Congress will provide clarification on the equitable service provision in the next stimulus. There may also be litigation in the meantime. And with that, I'll yield my time. Thank you, and I look forward to any questions you have.
Thank you, Austin. Now I'm going to hand it over to Ben Hush with NCSL's Natural Resources and Infrastructure Committee. Ben?
Thanks, Molly. I'll start with aid from the United States Department of Agriculture, or USDA. In the bill itself, USDA received $23.5 billion. About a week or so after passage by Congress, the agency announced the Coronavirus Food Assistance Program, or CFAP, CFAP. CFAP has 2 parts. $16 billion in direct aid to farmers and ranchers, as well as $3 billion to fund a food box distribution program. Unfortunately, the final details of the $16 billion in direct aid have not been released by the agency, but we are expecting them very shortly, potentially as soon as tomorrow, if not by the end of this week. These details will enable farmers and ranchers to determine how much aid they are eligible for. USDA has released the sign-up forms for the program, which of course can be filled out ahead of time in order to speed up applications once that process begins. However, Congress did release the total aid available for certain individual commodities, as you can see on the slide. There will likely be payment limits so that the aid can be more widely distributed, though again, the agency has not released those specifics. The final point I will make about this direct aid is while we are still awaiting the final details of this initial round of support, there is widely expected to be a second round for farmers and ranchers later this year using portions of funding included in the CARES Act as well as some existing funds that USDA has at its discretion. The $3 billion food box program is thankfully a bit further along in implementation. This program is designed to have USDA contract with food distributors whose business has been significantly impacted by the closure of restaurants, hotels, and other larger food service entities. And these contracts will enable distributors to maintain their purchases from farmers and ranchers to the tune of $100 million per month for fruits and vegetables, $100 million per month in a variety of dairy products, as well as $100 million per month in meat products for a total of $3 billion. Distributors will then use these products to provide a pre-approved box of fresh produce, dairy, and meat products to food banks, community and faith-based organizations, as well as other nonprofits. Next slide, please. The second type of aid available to the agriculture industry are two primary loan programs established by the Small Business Administration. And the first one you are probably more familiar with, which is the Paycheck Protection Program, or the PPP. And the second program is the Economic Injury Disaster Loan Program. The most important difference is that the PPP is actually arranged through your local lender that works with the SBA, while the EIDL program is a direct loan from the Small Business Administration. Additionally, the EIDL program is actually closed to everyone but farmers and ranchers. So farmers and ranchers are actually the only group of businesses that can currently apply. And if folks are interested in further details about either of these programs, NCSL has a highly detailed 3-page fact sheet, which I'd be happy to share afterwards. And that's all I wanted to say, and I look forward to questions. Thank you, Molly.
Thanks, Ben. Now I'm going to hand it over to John Jukery, who staffs our Labor and Economic Development Committee, to talk about unemployment. John?
Thank you. As you may know, last week, the U.S. Department of Labor reported that during the week of May 4th, Americans filed more than 3.1 million unemployment claims, driving the total jobless claims over the previous 8 weeks to now more than 33 million amidst this pandemic and economic fallout. I should say no state has been spared on the employment side of this virus. And I'm sure you're aware, you can see from these numbers on the slide, it's beyond shocking. The U.S. Chamber of Commerce just last week also crunched some data. And as you may know, if you look at these numbers within each state, based on the percentage of the workforce applying for benefits, Georgia is currently ranked number 2 in the nation in processed claims. That's right behind Kentucky, which is number 1, and ahead of Hawaii slightly, which comes in at number 3. So based on these numbers, 1.66 million unemployment claims have been filed in Georgia. And what does that mean exactly for the percentage of your workforce? It's close to 34.8% of the workforce in Georgia that's filed an unemployment claim. I should also mention too, I think one of the reasons why these numbers might be high as a percentage for Georgia compared to some other states is Georgia's ability to process these claims. There's obviously huge problems with computer systems crashing and data being processed to do this. Obviously, I realize too, Georgia is among the first states to start reopening their economy as well. I'm just not quite sure how this will be impacting the jobless claims numbers right now, as the data we're seeing is obviously always lagging behind at least a week or two. The Department of Labor reporting on the state unemployment data lags at least a week behind the national data. So definitely want to keep that in mind. We can hit the next slide here. Want to make sure you all are aware of NCSL's tracking on the state side of this issue. Our employment program is tracking state actions around unemployment, workers' compensation, occupational licensing, and states that have also have state laws regarding work sharing programs, such as short-time compensation programs. And then quickly, let's move to my final slide here, just go over where we're at now based on these previous two stimulus bills that were passed that Molly's mentioned. The Families First Coronavirus Response Act provided $1 billion in transfer payments to unemployment benefits. Each state receives that proportionally on the amount they pay, that's paid in by their employers. I can say this was chunked out into 2 funding mechanisms. So immediately back in March, $500 million was sent out to the states to cover administrative costs and technology systems. As far as I can tell right now, every state has burned through that $500 million. The second trigger of $500 million gets allocated when states have seen their unemployment claims increase by at least 10% over that same quarter in the previous year. It's my understanding, I think it's safe to say almost every state, maybe 2 or 3, have triggered this amount of money that states are starting to burn through. FFCRA also authorized the use of the extended benefits program, and it also waives interest payments that states owe for the remainder of the year on any federal advances they might make on their unemployment accounts. The CARES Act expanded unemployment from 3 to 4 months, and it also provides that $600 of extra payment per week for people that qualify due to the pandemic. I'll say since the passing of both these bills, the Department of Labor has been providing your state administrators and workforce agencies with implementation guidance on how to do this, frequently asked questions and best practices. And lastly, I should let everyone know too on this call that NCSL is tentatively planning a more focused and deeper dive on these unemployment numbers and programs on Friday, June 5th. And we hope to have someone from the U.S. Department of Labor on this call, and we also hope to provide some kind of more of our state tracking information and kind of the outlook and the future of work as we move forward. So just want to thank you all for the work that you're going to be continuing to do to get people back to work with this uncertain environment here right now. And happy to answer further questions if I can too. Thank you. Yield back.
Thanks, John. Now I'm going to hand it over to Haley Nicholson, who staffs our Health and Human Services Committee, to talk about some of the health care provisions. Haley?
Thanks, Molly. Good afternoon, everyone. So I'll start with the Families First bill that came out. A couple of different provisions in there, and Molly mentioned this first one in her initial comments. But the bill included a 6.2% increase for federal medical assistance percentages under Medicaid, also referred to as FMAP. And so any state that wants to elect to get that increase can do so. There are a few requirements for getting the increase, including that the patients enrolled under Medicaid can receive COVID-19 testing and related services at no cost. There can't be an increase in premiums, and there can't be a change of terms of how someone can enroll in Medicaid from what was already established prior to the pandemic starting. So no changes in terms for enrollment. If you want more detail on what states have done with this, what they can do with the increase, as well as some other Medicaid waiver provisions, there's a blog that one of my colleagues put out a few weeks ago, and I'm happy to share that with folks as well. Also under the Families First, so this applied to the 6.2 increase, it applies to a regular FMAP increase and not expanded Medicaid rates under the ACA. That was a clarifying question when this all began and these bills started to come out. We got a lot of questions on, so that's why we included this point here. And the bill also had no cost sharing, so no cost sharing for Medicaid and children's health insurance, also known as CHIP enrollees, and that would have 100% FMAP to cover those costs. Next slide. And then also under the Families First bill, there was $1.2 billion to cover testing costs for providers. This also, the bill required that no commercial insurance plans can, that they had to cover testing and diagnosis for COVID-19, but this could have no cost sharing to the patient. So ensuring that people would be going in to get tested and not worrying about any kind of complicated or increased balance billing efforts. And then also the bill appropriated $1 billion to the National Disaster Medical System. And this is used for them to give out for providers who have been testing uninsured individuals. So reimbursing for anyone that may have become uninsured and needs testing for those services. Next slide. Then under the CARES Act, there were a couple of different things. Medicaid, just a few quick things on that. They extended some programs, including Money Follows the Person until end of November of this year, and continued protection against spousal impoverishment. And those are two Medicaid programs that have gotten a lot of attention from Congress this year. So you may have heard about them or seen some coverage on those. So those programs, because appropriations and other processes are not in a normal known place at this point, they wanted to ensure certain programs were covered until they had a better sense of timing to take up those kinds of issues. The bill also delayed by 30 days a requirement, and when I say second package, that's Families First, that a state maintain premiums to receive that FMAP increase. The bill also delayed disproportionate share hospitals, also known as DSH payments, until December 1 of 2020. Again, an ongoing topic that Congress has discussed, but with the schedule being irregular at this time, putting things in place so that it didn't have to be visited immediately when the pandemic had started, or even until the summer, until the schedule is better known. It also reauthorized a couple of different pieces for healthcare workforce, including Title VII of the Public Health Service Act. And what this is doing is helping support clinician training and faculty development, being aware that some of these trainings and development was needed, and even more so now as staff is, not only helping in their home states, but some of you have probably seen going to border states or other states in different parts of the country to help, being sure that they're prepared and trained, but that they have the flexibilities they need to. So there was quite a few workforce updates, including this one. Next slide. And then I just want to give a snapshot. This is different funding that went out under CARES to all the different health and human services agencies and administrations, covering a number of different things like testing, personal protective equipment, mental health resources and grants to states. And one big piece of that that's gotten discussed quite a bit is a $100 billion fund that was set up. It's been referred to as the Provider Fund. And what it does is it will reimburse for expenses or lost revenue as a result of COVID-19. And this can be directly from an increase in patient care for COVID-19, but also when it was advised to delay or cancel for the foreseeable future any elective procedures. That way that you're ensuring that the facility has the space in case there is an increase in cases and care for COVID-19, but also not bringing people in and having unnecessary exposure. Since then, the CARES 3.5 bill, or the Paycheck Protection Program and Healthcare Enhancement Act, sorry, it's a bit of a mouthful. That bill also did put another $75 billion into the Provider Fund. HHS has been distributing that money, and in CSL we have a breakdown of, they did an initial $30 billion in funding for providers. That first round was based on their Medicare fee-for-service schedule. They did get feedback that wasn't completely reflective of all the providers that are being impacted, especially those in rural areas that may not have as big of an increase in some scenarios, but are losing a lot of revenue by canceling elective procedures. So HHS has further broken down how they're going to allocate those funds for rural areas, different targeted allocations, and took into consideration after that first round of funding went out. So it's $175 billion total at this point. $30 billion has gone out from HHS, and they have allocated how some of the future funding is going out, and it should have gone out or will be going out this week. And I'm also happy to share with you, they put out a website that breaks down all the funding that's gone out under COVID-19, so you can get a breakdown of your state for providers. Also, some funding that was included in CARES was $275 million to expand services and capacities for a number of facilities, including rural hospitals, for telehealth work, the Ryan White HIV/AIDS program, and all of those funds go through HRSA, which they've also been giving updates weekly on where those funds are going through states, and if there's provider specific, which providers are receiving funds. And then the bill also included funding for community health centers for FY 2020 to help maintain or increase staffing capacity to help address COVID-19. Next slide.
I think that's it.
Yep. I think that's okay. Well, that's all I have.
Thanks.
If you'll have more questions, please let us know. And our colleagues in Denver also, I was able to participate. We did a health webinar series. There's also a human service webinar series that we've broken down since this legislation and funding's gone out. What does that look like for the states? How states use that and other flexibilities in the health and human services space. And so if you want to access any of those webinars, or if you have any follow-up questions, I'm happy to share those with you. Thanks.
Thanks, Haley. Mr. Chairman, that completes our formal comments. One thing I will leave you with is that Congress is considering another package, which we'll call 4.0. The House Democrats proposed and passed a $3 trillion package this past Friday. There's strong, as I'm sure you've all been reading, there's strong opposition from members of the Senate on many parts, but the House did want to get a marker out there for negotiation. It's hard to know at this point what will be in a final package and what the timing is. But NCSL is advocating for, you know, flexible assistance for states, and we are here to help you navigate all of this. This is just, you know, please use our website. There's lots of resources on there. And then I will leave you with everyone's contact information if we don't get to all the questions today. So, Mr. Chairman, I will hand it back to you, and I'll leave the point of contacts up for a few seconds, and then I'll just stop sharing my screen.
Okay, thank you, Molly. Thank you to all the presenters today. We do have some questions, and wanted to touch real quick first to Ben. On the food box purchase program, is there a requirement there that it be American grown, US grown product, or is it open to still imports being able to come in? Because ultimately it doesn't do our producers a whole lot of good unless there is some kind of requirement.
Sure. So the contracts from USDA go to wholesalers and distributors, and I guess to directly answer your question, I'm not positive, but I'm pretty sure that the contracts require the food to be fresh, and there are different definitions of fresh depending upon the product that we are referring to. So I would imagine that most of the products being purchased by the distributors that have the contracts with USDA are from regional areas. And I say regional because if you look, and USDA has published all the contracts online, if you look at them, they actually split up the country into, I believe, 7 different regions. Georgia, of course, is in the Southeast region. There is a Northeast region, a Midwest Plains, a Southwest, and a West region.
Okay, thank you. Moving on to the next question. Has there been any discussion, and Molly, this may be for you, has there been any discussion about extending the deadline for COVID spending past the December 30th deadline?
So I will tell you that we have heard from a number of states that they would be interested in exploring having that, you know, year-end deadline extended. I have not necessarily heard talk about it at the federal level. I don't know if Erlinda, have you heard anything?
I have not myself, but like you said, we've heard states talk about it. I mean, I think it's definitely an option when we talk about flexibility to consider. And if there is a groundswell for, you know, for any of our efforts to reflect that, I'm sure we'd be open to it.
Because it doesn't coincide with state fiscal years, with federal fiscal years, and someone even pointed out it's kind of arbitrary that it's December 30th, not even 31st. I mean, so, you know, we'll see if it can be a point of conversation in 4.0. Okay,
all right. In the healthcare funding stream, a couple of questions there. Haley, did I understand you to say, or did one of the slides say something about DISH being delayed until December, disproportionate share?
Yes, it is delayed. The cuts are delayed until December 1st, 2020.
Okay, the cuts, not the actual payout. Okay, perfect. Mm-hmm. Okay, yeah. All right, good. What about in the FMAP, on that FMAP increase? What kind of consideration is in there for skilled nursing, long-term care type facilities?
I would have to look, I'll have to follow up with you on that specifics, because what we've gotten is generally kind of if the state wants to allocate it and then the services they can use it for. So let me follow up with you. And Emily Lanford in our Denver office is our Medicaid program specialist. So she may have a better idea of that specific breakdown for funding.
Okay. All right, thank you.
Mm-hmm.
So I see in the chat box, y'all, if you want to ask a question, go to just wiggle your mouse around, go to the bottom. You'll see a chat on the toolbar down there at the bottom. Just click on chat, and you can go there and ask questions. And our NCSL folks are kind enough that they're responding to several of the questions in the chat box as well. So if I don't ask your question, it's because they have answered it there. So another question, will each school district submit applications for funding, or is there a set formula?
Yep. There is a set formula. All the money that's sent to districts flows through the state agency to the district based on the federal Title I formula, and that's generally based on a district share of low-income students. I'm not sure what the application process will look like from the Georgia Department of Education. States have a little bit of discretion in putting that application together. As of the other day, last Friday, they had said that they were going to put out a webinar for districts to explain the application process, but I haven't seen any official products from them. But I would imagine that it would be fairly straightforward.
Okay. I know for our House members, committee members, we have sent out the breakdown of what Georgia DOE did the other day on what went out to the district. So you should have that in your inbox as well. Will version 4.0 have a more proportionate distribution formula to population and state size? Don't everybody jump at once.
I didn't know whether Linda wanted to jump in or did she want me to do it because she was covering the CRF.
Is it for the direct aid to states, I'm assuming, or okay? So there, well, I have to look back at my notes now. Can you give me a couple minutes to look back at my notes real quick, and I'll get back with you real quick, sir? Would that be
Sure.
okay?
Sure,
Okay,
absolutely.
thank you. All right.
Absolutely.
I do know there is some interest, at least, on maybe bringing in, and Erlinda will get the details of the number of COVID-19 cases that maybe there's I have a feeling the formula will be different, but Erlinda's looking up the details.
Okay. All right. One other just kind of general question. There's been a couple of different versions put up here, and I'll just do it so everybody can hear if they're not looking at the chat box. But it deals with local school systems doing any kind of testing of school-aged children in preparation for returning to schools in the fall. Will there be any kind of special funding that y'all are aware of that will be going out to the districts for that?
I haven't heard any proposals for a dedicated federal funding stream for testing, although a state could choose to exercise its discretion to put together such a program. I would think that the state agency set aside or the governor's funds would make sense for a statewide testing program. There may also, to the extent this would vary by states, but perhaps there is certain unspent money from this spring's testing cycle that could be reallocated, but I can't comment on Georgia's status there. But no specific proposals. Most of the education funding now and for the future has been really discussed in more broad, flexible terms rather than targeted uses.
Okay. And then will school systems providing the food program only receive reimbursement through the education relief funding and not through the funds for the agricultural food assistance? I guess, Ben, that would be you.
Sure. So as much as I can answer this, to my understanding is schools are not involved in the CFAP program. There are a number of other nutritional programs that do involve the school system that are outside my area of expertise. So I don't want to go too much down that road, but to my understanding, the CFAP does not include those programs that are more directly addressed at nutrition issues with schools.
Okay. And I would assume too that the systems would have the flexibility on that direct money that flowed to them a week and a half ago based on Title I. They could use some of those funds for that as well. Erlinda, do you have the information? Okay.
Yes, sir. So in phase 4, at least the House passed version now, there's $500 billion total that's supposed to be going to states in addition to what's already been allocated through the CRF, and $250 billion is going to be divided, or $51 billion of the $250 billion is going to be divided equally among the 50 states and DC. 49 of that 250 will be awarded based on the state's share of COVID cases, and then 150 billion will be awarded based on the state's share of population. So there was an effort to try to be, I guess, a little more equitable with respect to the distribution of the funds based on, COVID cases and as well as population. There's some sort of there's more of a formula involved in the allocation of those funds.
Okay. All right. Any other questions? I think we have got everything. If somebody has sent a question on chat and I've missed you, I am sorry, but I'm looking at the whole list here, and I think we've basically touched on everything that anyone's asked about. Molly, do you have anything to kind of wrap us up? We're at 44 minutes into it. We've told everybody we're going to try to keep them about 45 minutes. So,
great. Thank you again for having NCSL. And if anyone has any follow-up questions at any point during this process, you know, you can reach out to any one of the staff, to myself, and, you know, we're here to help. If you have follow-up questions, please don't hesitate to reach out. We're here to help.
Okay, thank you. And I believe Martha we've been texting back and forth. I think she's checked with you about the slides you had being available to folks. And if you would just send those to Martha, and she'll get them to my admin, Ashley, and to Chairman Tillery's admin, Jasmine, and we'll get those sent out to our members and everything. Chairman Tillery, you got any other comments?
First of all, thank you so much again, Molly, Erlinda, Austin, Ben, John, Haley. Thank y'all so much for your help and for making this a really power-packed 45 minutes. I hope it's been helpful to the members as well, and that you've enjoyed it, that you found it very informative. Remember, also in your inbox already are the distributions that we've received as a state for K-12, higher ed, and then healthcare providers. So you can look at those if you have questions about your specific district. Thank you guys so much for being a part of this.
I would echo again, Chairman Tillery's thank you. Thank y'all so much for taking your time to be with us and share your insights as to what y'all have been learning. We appreciate the job that NCSL does on a daily basis on kind of being the state's voice on Capitol Hill and trying to keep us all kind of plugged in and in the loop to what is going on. It's certainly a time that we're still all trying to learn as fast as we can, and we'll continue to do that over the next several months as we're trying to figure out how these different pieces of the puzzle fit together. Ladies and gentlemen, if there's nothing else, again, thank you to everyone for being on the call, and we are adjourned.